and constituent response. Dr. Michael Caldwell, Metro's Public Health Director, and Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department are here with us to help answer your questions. We will now begin with Mayor John Cooper.
Good morning, Nashville. I'd like to start by reminding everyone that the Metro Public Health Department, at my direction, has extended the Safer at Home order until April the 24th. All residents should continue remaining at home except when running essential errands and should avoid gatherings at all costs. Essential businesses will remain open to serve the public, while non-essential businesses will remain closed. Now, I want to be clear. Residents and businesses will face fines and misdemeanor citations if they violate the Safer at Home order. Non-compliant businesses will face other consequences, including civil penalties, padlock orders, or suspended or revoked licenses and permits. Metro Police, the Department of Public Health, and the Office of Emergency Management have formed compliance teams to enforce the order throughout Davidson County, and will begin investigating reports of non-essential business operations, unlawful gatherings, and other Safer at Home order violations. Now, I'm grateful to Aaron Williams, Director of Hub Nashville and Constituent Response, for joining us this morning to talk about the features of Hub Nashville and how residents can use this important service to report suspected violations of the Safer at Home order. Our thoughts are with those who are sick with the coronavirus, and we extend our condolences to the family and friends of those who have died. Now, we must all work together to flatten the curve of the coronavirus infection rate in Nashville. This helps our first responders, supports our frontline healthcare workers, and will save lives in the process. I'm grateful to Dr. James Hildreth, President and CEO of Meharry Medical College, for joining us again this morning to provide his wisdom and insight into the COVID-19 outbreak, our response as a community, and what each of us must do, in his words, to avoid becoming a vector for the disease. Now, I'm also pleased to announce this morning that the deadline to apply for Metro's tax relief and tax freeze programs has been extended from April 6th until May 6th, 2020. These are important resources for residents, especially at this time. I'm grateful to Trustee Parker Toller for working closely with the state and our office to extend this deadline for the benefit of Nashville taxpayers. Renewal vouchers for the tax relief and tax freeze programs may be mailed to the trustee's office or placed in their secure drop box located directly outside the Howard office building at 700 2nd Avenue South. Senior and disabled taxpayers who wish to apply for the tax relief or tax freeze program for the first time should call this number, 615-862-6330. Now, you can also call this number to learn more about these programs available through the trustee's office. And that number, again, is 615-862-6330. Now, as part of our citywide COVID-19 response, Metro currently has 3 community assessment centers fully operational. One located in Antioch near 2491 Murfreesboro Pike, another in Nissan Stadium in Lot N, and a third location at Meharry Medical College at 918 21st Avenue North. Hours of operation for all 3 locations are 9 a.m. to 3 p.m. Monday, Wednesday, and Friday until further notice. Now, before visiting a community assessment center, residents must first call the COVID-19 hotline. And that number is 615-862-7777. 862-7777 between 7 a.m. and 7 p.m. Monday through Friday to receive an initial assessment by a public health professional. Yesterday morning, I mentioned 2 resources for individuals who may be experiencing a mental health crisis. Now, I cannot stress enough, mental and behavioral health services are essential in Davidson County under the Safer at Home order. And I urge everyone to continue caring for their mental health as well as their physical health as we confront the coronavirus as a community. Now, if you do not currently have a mental health provider, please visit covid19.nashville.gov and follow the link to the COVID-19 Response Fund to find local mental health service providers that are offering sliding scale fees and telehealth appointments. If you are experiencing a mental health crisis, call Mental Health Cooperative's 24-hour crisis line at 615-726-0125. And if you are experiencing thoughts of suicide, call 1-800-273-8255 to speak to a counselor. The call is free, confidential, and available 24/7. Now, this morning, I'm pleased to announce that Ingram Charities will grant $100,000 in the support of the COVID-19 Response Fund, which has raised $3.16 million to date. I'm grateful to the Ingram Charities for joining other local organizations and individuals that have stepped up to help Nashvillians who are facing hardships during these tumultuous times, including the Frisk Foundation, which contributed $1 million to the fund, the Tennessee Titans, who donated $50,000, and the Music City Center, which donated $500,000, and the Nashville Convention and Visitors Corporation, which helped kick off the Response Fund with its first $500,000. I'm also happy to report that the COVID-19 Response Fund has allocated an initial $300,000 to the following nonprofits that are providing direct individual assistance to Nashvillians: the Catholic Charities, Connexion Americas, Martha O'Brien Center, Need Link Nashville, Rooftop Nashville, and the Salvation Army. The COVID-19 Response Fund Committee, chaired by Senator Bill Frist, is now working through response fund applications and will allocate funds on a rolling basis in order to meet community needs as quickly as possible, beginning April 3rd. Area nonprofit organizations can visit NashvilleResponseFund.com to apply for these response funds. And as a reminder, anyone can visit covid19.nashville.gov to make a contribution to the Response Fund or to find information on obtaining direct financial, food, housing, mental health, social service, unemployment, and utility payment assistance. And now I'll turn it over to Dr. Alex Shahanger, Chair of the Metro Coronavirus Task Force. Thank you.
Thank you, Mayor Cooper, and good morning. Here's the latest information on COVID-19 in our city. We have now a total of 785 confirmed cases. That is an increase of 112 cases over the past 24 hours. A 5th person in Davidson County died yesterday. He was a 73-year-old gentleman. Our sympathies do go out to his family and friends as well. Yesterday, we confirmed the virus has infected a 1-month-old child, and the oldest patient is 84 years old. Of the confirmed cases, 20 are currently hospitalized. 665 individuals are self-isolating at home with mild and manageable symptoms, and 95 people have recovered and are cleared of the virus. As the Mayor Cooper just said, yesterday all 3 community assessment centers were open to screen Nashvillians. In the first 2 days of operation, 658 Nashvillians were assessed. Of those, 402 were tested for the COVID-19 virus. Just yesterday, 603 people called our assessment hotline for an initial assessment and screening. The average wait time for callers was less than 30 seconds. The hotline and centers are part of our larger community assessment system, which we created for Nashvillians who are concerned about the virus. It all starts with a phone call. If you think you have symptoms, call our hotline, 615-862-7777. The hotline is open 7 days a week from 7 a.m. to 7 p.m., and you'll have a medical professional who will answer your phone calls and your questions. They will also determine if you need additional assessment and screening, and if you do, they will refer you either to your own provider or to one of our community assessment centers. These drive-through centers have additional screenings, and if needed, you will get a medical test. A COVID test. These are in operation Monday, Wednesday, and Friday from 9 a.m. to 3 p.m. The community assessment system expands our ability to assess and screen more Nashvillians. This is in addition to the great work that is being conducted by all our health systems already. Our hope is that our community assessment system and centers further ease some of the pressure that our health systems are facing. As was reported yesterday, the state's Unified Command is developing a plan to create a regional alternative care sites across the state in anticipation of the surge of inpatients that may occur because of this virus. The Nashville Coronavirus Task Force and the local healthcare systems have been involved, and we will assist the state in the implementation of the plan for our region. The governor and his team will release more information about the sites and the number of beds for this emergency surge plan, hopefully as early as today. If you would like to help with the alternative care sites, please sign up for the Tennessee Medical Reserve Corps. We are needing both medical professionals and volunteers. There is a link to the state site on our website, covid19.nashville.gov. Also yesterday, the Safer at Home order was amended and extended until April 24th. It added some clarity to the list of essential businesses, and it mandates social distancing. I would also like to add some clarity to this order. Unless it is absolutely necessary, don't go outside. Stay home. That's the most important thing to remember about the Safer at Home order. I need your cooperation and I need your help. It is a fact. Social distancing and staying at home will stop the spread of this virus. Let your friends know. Let your family know. Tell them to stay at home and tell them why. It is the most important message. Spread the word and not the virus. Thank you so much, and I'd like to introduce Dr. Hildreth from Meharry Medical College.
Good morning, Nashville. In January of 1918 in Haskell County, Kansas, a local doctor reported a severe case of pneumonia to the U.S. Public Health Service. A short time later, a company cook from Haskell County reported sick at Fort Riley. He was the first known case of H1N1 influenza in the pandemic of 1918. This virus infected 500 million people, which was a third of the world's entire population, and it killed somewhere between 30 million and 100 million people. It was quite simply the most devastating pandemic in recent human history. Many have commented on the similarities between the pandemic of 1918 and the current coronavirus pandemic. Both resulted from viruses that adopted to use humans as vectors and not animals. Both viruses are highly contagious, and notably, both viruses spread by the travel of humans around the globe. In the case of the 1918 pandemic, soldiers fighting in World War I congregated in large groups, traveled in large groups, and of course they travel all over the world, and that's how the virus spread. Historians have pointed out that governments failed to fully disclose the seriousness and the global nature of this pandemic, and that resulted in rapid virus spread and probably more loss of life. I would like to point out some important differences between the pandemic of 1918 and the current COVID-19 pandemic. In 1918, doctors didn't even know that influenza viruses existed. As a matter of fact, they thought the disease was caused by bacteria. In 1918, there was no CDC, there was no NIH, there were no scientific diagnostic tests for viruses, and there certainly weren't drugs to treat bacteria or viruses. As a matter of fact, penicillin, the first antibiotic, wasn't discovered until 1928. There were no ICUs, no sophisticated devices like mechanical ventilators. In 1918, there was quite simply nothing that could be done except to offer supportive care. All of this can be summed up by saying that the pandemic of 1918 was a pre-modern science pandemic. The scientific discoveries and advances in medicine, engineering, and material science since 1918 are simply astounding. Now in 2020, the COVID-19 pandemic has occurred at a time when every day we demonstrate our complete faith and trust in science by the things we take for granted. We use our GPS system in our cars, trusting we won't end up in a ravine. We get on board these giant aluminum tubes that ascend to 5 or 6 miles in the air, trusting that they're not going to fall out of the sky. Collectively, we take millions of pills every day, and these are powerful chemicals, trusting that they will do us good and not harm. We allow anesthesiologists to infuse us with, frankly, poisons to put us to sleep, trusting that they'll wake us up when the procedure is over. We take actions when meteorologists warn us of approaching storms. All of these things and many, many other things demonstrate that in our daily routines, we have entrusted our very lives to science. Now, lately we've heard a lot about models that are meant to tell us the course, scope, and breadth and consequences of pandemics, including this one. These models are based on some very elegant and sophisticated science and math. Science and mathematical models put humans on the moon and probes on Mars. Science and mathematical models transformed agriculture to make sure that our food supply would be sustainable. These are just two examples of many examples of the power of mathematical models in science. And in this age of very large data sets and artificial intelligence, these models are amazingly accurate. So the world in 2020, we have such models in science. In 1918, they didn't. So we have the benefit of tools, technology, experience, and expertise to allow us to make the outcome of this pandemic very different than the one in 1918. In order for that to be the case, we must simply trust the science and models that are the basis for the things we're being asked to do. And they are based on science and very amazing models that predict the course of this pandemic. So we've literally entrusted our lives to science and mathematical models every day, so why should this be any different? So I'm asking us to put the same faith and trust in science, powerful science that we do, to make the virus get behind us. And as a reminder, pandemic viruses require vectors to pass from one host to the other. In the past two pandemics, there were animals, cats, and camels. In this pandemic, it happens to be us. We are the vectors, Nashville. So let us protect our T-zones, wash our hands frequently, stay at home, stay safer at home. And by doing so, remember, please don't be a vector for COVID-19. And with that, I'd like to introduce Erin Williams from Hub Nashville.
Thank you, Dr. Hildreth, Dr. Jahangir, and Mayor Cooper. Good morning. I'm Erin Williams, Director of Hub Nashville, the one-stop shop for non-emergency services in Metro Nashville, Davidson County. If you have needs for Metro assistance related to COVID-19, tornado recovery, or everyday Metro services like codes enforcement, pothole repair, or access to social services, you can reach Hub Nashville at hub.nashville.gov, through the Hub Nashville 311 app, or by calling 311. As Mayor Cooper has said, you can utilize Hub Nashville to find information about COVID-19, ask questions, or share concerns about possible violations of the Safer at Home order. We will route these questions and concerns to a team at the Metro Public Health Department for response and investigation. Throughout the past several weeks, the Hub Nashville team, both on the phone and in technical support, has worked long hours to respond to the needs of our community. Thanks to Mayor Cooper's direction and support, we've been able to adjust and adapt to the changing needs of Metro departments, Hands-On Nashville, and the community, all while working safely from our homes. I'm grateful for the flexibility and dedication of the Hub Nashville team and all the Metro employees who are supporting us. Thank you.
Thank you, Dr. Hildreth and Aaron. We will now start the Q&A portion of today's briefing. I will announce your name aloud from the podium, and you may proceed by asking your question over the air. We will start with Peter White from the Tennessee Tribune. Peter, you're on the air.
Thank you. This is a question for Dr. DeHanger. It's a question I've asked before. A study just came out, Council of Mayors queried a whole bunch of cities about their needs, and Nashville is not alone. As you probably know, Doctor, like 80-90% of the cities surveyed just didn't have enough stuff. And we're talking about masks, PPE items, test kits, ventilators. So my question is, can you give us a sense of what we need to get to the point where we can, actually start flattening that curve that everybody's talking about? Because right now, the infections are just going up and up and up.
Dr. Jungir.
Peter, good to hear from you. It's a great question. I would tell you, as we stand today, I feel like we are doing okay with equipment, okay? So PPEs, beds, tests. In fact, Peter, 7,661 individuals have been tested in Nashville as of yesterday. But the greater question, you're talking about flattening the curve, and I think this is where it's important, is there is always a risk of us running out of stuff, and I put stuff in a broad speak, if we have a large influx of people that get sick at one time. So the whole flattening the curve message means if we have less people infected at a single time, then there'll be less resources needed at that moment in time. And so, I know we're in constant, we internally as a city with our hospital partners are aware of what is going on internally, but then also with the state and unified command, and also the state with the federal government are always make sure the supply chains are clear, but we keep a constant eye on it every day. But the key here is less people needing resources at one moment at a time will make it less likely that we're going to run out of any critical component of that. So thank you.
Tosin Fakile, you're on the air.
Good. The first was at the juvenile detention center with the officer who's detected. Are you guys going to do anything in terms of moving people around or shutting things down, or I don't know what you guys are going to do about that situation? And my second question is, because I didn't really hear clearly from Dr. Jahanger, the regional operation that the governor's going to talk about, can you fill us in a little bit about what that is and like how many beds are going to be brought out and how involved is Nashville going to be in that process? Thank you.
Dr. Jungir.
Let me answer the first part. The details of the plan the governor's going to release, I'll let him release. But I can tell you from the first moment that this discussion of an alternative care site has been proposed, me specifically, Mayor Cooper, Dr. Caldwell, Chief Swan, have been involved. We have our regional healthcare systems, and I want to highlight, we're not just talking about the hospital systems in Nashville, but regionally involved. I've spoken with Commissioner Piercy. We are very instrumental in coming up with how that will be operational. There's going to be a lot of this is a state led initiative, but we're going to make sure people in our region are taken care of. So we're very involved. I will defer on details more than that right now, but know that every second, in fact, this morning, Mayor Cooper and I were briefing about this. I know he's reached out to Unified Command to talk about this further. So more details to come, but no, we're very involved, and this is not just a state in isolation. The region and our regional experts are involved. Regarding the prisons, just 1 second, please.
Thank you, Dr. Jahanger. The Juvenile Detention Center, let me just take one moment to let you know that we're going to be hearing more and more about positive tests in many different places. And this is a good sign because it shows that our testing system is ramping up. and that we are able to take this information and take more specific action directly and enhanced action. But remember, we're telling everybody to assume that they are infected and that anyone they meet could potentially be infectious to them. So procedures throughout the community, and specifically in these particular centers and others like them, are already having enhanced procedures to assure social distancing and assure maximum cleaning. Our epidemiological staff are going to be responding to this particular case as we're responding to the many hundreds of cases to get the specific details on what this particular employee was doing, who they were in contact with, so that we can have a much more focused testing of people who they may have been in close contact with. This is what we do with every case, and this particular situation that you brought up is no different. So I'm confident that our public health system is responding, but we need everyone to hear this and know I could infect you, and you can infect me at any time, and if we all approach it, no matter what situation we're in, we're going to be able to move this virus away from our community. Thank you.
Harriet Wallace, Fox 17.
Yes, good morning. You all spoke yesterday about concerns with first responders, police, and their safety. My question today is, if that does happen, from a proactive standpoint, what is being done to prepare for that? Have there been conversations with neighboring mayors? Has there been a conversation with the governor? What is the plan if we have departments that are already short become shorter staffed due to the virus?
Chief Swan will field that question for us.
Good morning. Great question. I can assure you that all of the services from the fire department, police department, sheriff department, and even the Department of Health, we've taken measures to make sure the first thing we do is that we do what we do every day. We wear our personal protective equipment, have a conscious awareness of the corona-19, and we put things in place to make sure that, number one, we are looking at our employees as our number one asset, and we're encouraging them to do the things that they should to protect themselves. And we've got an individual plan, each department, of how to try to capture if our workforce goes down. So again, we in close proximity to each other as far as a department to make sure that our plan works and is efficient. And we have reached out to, I know I have, as far as the fire department, we reached out to our neighbors. But unfortunately, as you know, this is a pandemic. So the same problems that we are concerned about or facing, so are our neighbors. So just as we are pushing the safer at home and practicing social distancing, even within our interdepartmental, even though it may be a little bit more difficult for some, like the fire department, where we live together and we're a family, we still do everything we can do to make sure that we are practicing social distancing and also taking those steps to make sure that all our personnel are well taken care of. Thank you.
Our last two questions are Nancy Ammons and Julia Palazzo. We'll start with Nancy Ammons.
Thank you. And thank you for all you folks are doing. You're doing such a good job, and we really appreciate your being able to take our questions. I have two questions. One, how many extra hospital beds are going to be set up in Nashville? Will you use Music City Center, Bridgestone Arena, Nissan Stadium, colleges? And the second question is, the state has announced yesterday they got millions of PPEs, but the governor's office says 80 to 90% of those supplies are going to rural areas. How much is Nashville getting from the new shipment that United Command just announced yesterday?
So the second part of that question was about PPEs and how much we are getting from the shipment that Unified Command got. Dr. Jahangir.
Nancy, first of all, thank you for your kind words. It is very important for us to to be as open with our community as we can. Regarding the size of the center, first of all, it's a substantial number. I really would prefer that the state announces that, and as far as location, but I can tell you that it's substantial, and it's what the models show that we need for our community. So that's number one. Regarding the other question, I'll be honest with you, we don't have an answer for that right now. We'll find out the information and get back to you. So I apologize. I just don't have a good answer for you on the second part. Thank you.
Julia Palazzo, WKRN.
Hi, thank you so much. Good morning. Just wondering how many medical professional volunteers you think you would need to help run the alternative sites, and also how will they be kept safe?
Kept safe.
Oh, kept safe.
Yes.
That number will be determined based on modeling and planning that we, along with the state, are doing. As you staff anything, whether it's a hospital or a movie theater, there's models about how many people you need depending on the acuity. So let us work through that, and I'll get you the right answer. Regarding how they'll be kept safe, I mean, that answer is the way we try to keep every one of our frontline healthcare workers safe. Proper PPE, proper protocols, proper awareness that if you are exposed or feel you have symptoms, to immediately get assessed and immediately isolate yourself. I think those protocols are universal across all facilities. But the details of how many staffing and all, I mean, we're going to do that again. We're so fortunate to live in a city that has so many amazing healthcare executives and healthcare administrators, and we are using those resources every second to get the right staffing models for as large of a center as this is going to be. Thank you.
We have one final question from Ian Jung at the Tennessean.
Oh, good morning. I had two questions. One, I was wondering if Metro Health can provide just kind of the true hospital capacity numbers for us. And I know that changes on a day-to-day basis, but hoping that maybe you can follow up, whether you know it now, in an email with the media. And then two, wondering how the 1-month-old is doing, as well as the 2-month-old reported last week. Wondering if you can share any information about maybe pediatric cases here in Nashville, if we've seen any trends, or maybe a number of how many infants are being tested for COVID-19.
Dr. Jahangir.
Yeah, thanks. So regarding the 1-month-old, I was conferring with my public health colleagues right now. They are still doing the contact tracing and the phone calls with the family. So I don't know how that person is doing at this moment. Regarding hospital capacity, the exact number in Davidson County, I'm not sure about today. I did look this morning at the HERT system for the state, and we're still at the 34-35% capacity statewide. My understanding of the hospital systems in the city right now is that we are actually doing well. I know for a fact their ICU capacity within Davidson County, as I've mentioned before, I have a regular dialogue every morning around 5 a.m. with all the ICU leaders. And so I know we have ICU capacity. I'm pretty confident we have hospital bed capacity. And I know the state, based on the database I looked at this morning, is at 34% availability. So that's what I can provide today. Thank you.
Thank you, everyone. A video recording of this broadcast will be made available later today. This concludes today's Metro COVID-19 press briefing.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about